Welcome to UMCC Medical Consultants. Sleeping sickness, also called trypanosomiasis, is a serious illness. It affects people in Africa. The disease makes people very tired and can be fatal. This essay explains what causes sleeping sickness, how it is diagnosed and treated, and how to prevent it. Sleeping sickness is a serious public health concern in many parts of Africa. It is important to understand this disease so we can prevent it and treat it effectively. Sleeping sickness is caused by tiny parasites. These parasites are microscopic organisms that can have a devastating impact on human health. They are not visible to the naked eye and require specialized equipment to be seen. These parasites are called trypanosomes. Trypanosomes are a type of protozoa, which are single-celled organisms. They have a complex life cycle that involves multiple stages and hosts. They live in the blood and other bodily fluids of infected people and animals. This allows them to spread easily within the host's body, causing severe illness and sometimes death if left untreated. The parasites are spread through the bite of an infected tsetse fly. The tsetse fly acts as a vector, meaning it carries the parasites from one host to another. The tsetse fly lives in rural parts of Africa. These areas are often remote and lack access to medical care, making it difficult to control the spread of the disease. When the fly bites an infected person or animal, it picks up the parasites. The parasites then multiply within the fly, making it capable of infecting others. The fly then transmits the parasites to other people and animals through its bite. This cycle of transmission continues, perpetuating the spread of sleeping sickness in affected regions. Sleeping sickness, also known as African trypanosomiasis, can be incredibly difficult to diagnose in its early stages. This is primarily because the initial symptoms can be very similar to those of other common diseases, making it easy to misdiagnose. Early symptoms of sleeping sickness include fever, headache, weakness, and itching. These symptoms are often mistaken for malaria or other viral infections. As the disease progresses, more serious and distinctive symptoms begin to appear, which can help in making a more accurate diagnosis. These advanced symptoms can include severe confusion, noticeable personality changes, and significant sleep disturbances, which are hallmark signs of the disease. To confirm a diagnosis of sleeping sickness, doctors rely on blood tests to detect the presence of the parasites responsible for the disease. In some cases, they may also need to examine fluid from a lymph node or perform a spinal tap to look for the parasites in the central nervous system, ensuring a comprehensive diagnosis. Section 4. Prevention: keeping the tsetse fly at bay. Preventing sleeping sickness focuses on avoiding tsetse fly bites. This can be done by wearing long-sleeved clothing and pants in areas where flies are present. Using insect repellent is also helpful. Community efforts to control tsetse fly populations are crucial. This can include using traps and insecticides. Additionally, travelers to areas where sleeping sickness is present should take precautions to avoid being bitten by flies. Section 5. Treatment: fighting back against trypanosomiasis. This section delves into the various methods and strategies employed to combat this debilitating disease. Treatment for sleeping sickness, also known as trypanosomiasis, depends significantly on the stage of the disease. Early detection is crucial for effective management. Early-stage disease can often be treated effectively with medications that target the parasites before they cause severe damage. These medications are generally more accessible and have fewer side effects. However, late-stage disease, where the parasites have invaded the central nervous system, is more difficult to treat. This stage requires more potent medications that can cross the blood-brain barrier. Medications used to treat sleeping sickness can have serious side effects, including neurological complications and organ damage. These side effects necessitate a careful and balanced approach to treatment. Close medical monitoring is necessary during treatment to manage these side effects and ensure the patient's safety. Regular checkups and tests are essential to track the progress and adjust the treatment as needed. Research is ongoing to develop safer and more effective treatments for sleeping sickness. Scientists are exploring new drug formulations and treatment protocols to improve patient outcomes and reduce the burden of this disease. Section 6. Conclusion: staying ahead of sleeping sickness. Sleeping sickness is a serious but preventable and treatable disease. Understanding the causes, symptoms, and prevention methods is essential in the fight against this illness. Early diagnosis and treatment are crucial for a positive outcome. Continued research and public health efforts are necessary to eliminate sleeping sickness and protect vulnerable populations.